Fourth, you have to save Medicare and Social Security. I spent years on this project. I chaired the Medicare Reform Task Force of 1996. We saved it for over a decade. I've been involved at the Center for Health Transformation. It requires new thinking in the Lincoln tradition. On Social Security, it's simple. Every young American should have the right to choose whether or not they want a personal Social Security account on the Chilean model. And here I agree with Herman Cain. He's got it down exactly right. It's a very simple model. You don't have to make it compulsory. I am against making things compulsory if you can avoid it. You go to young people and you say to them, would you rather have, and you show them the two clips of Obama in August saying, I may not be able to pay your Social Security check. Remember that? So you say, do you want to spend 70, 50, or 60 years of your life working knowing that politicians may at some morning not give you the money? Or would you like to have your own account that you control? Would you like a system that has no estate buildup? Or would you like to have a system where it's your money? Would you like to have a system where the politicians are going to tell you they got to raise the working age? Or would you like to have a system where there's no required retirement age? If it's your personal account, you retire when you feel like you want to retire. Why should the government tell you when to retire? By the way, 1,200,000 people over 75 still work. So if you don't want to retire, why should the government tell you you have to retire? I mean, this is all a 1935 model for an industrial era society which is gone. Now you say to everybody who currently is in the system, fine, relax. We're not going to change it. If you get the kind of economic growth that these two create, Social Security is fine for the next 30 years. And if 30 years is a long enough transition period, you're going to have probably 80 to 90% of the population in the new model. And they literally, over their lifetime, get out of compound interest 2.5 to 3 times as much money as they're going to get out of the current system. On Medicare, very simple. You start with something that we published a book on called Stop Paying the Crooks. Now, you would have thought Stop Paying the Crooks was clear enough that even in Washington, it would have led to serious conversation. Didn't have any impact. The Center for Health Transformation published it 3 years ago. I was very confident it would break through. No impact at all. Here are the numbers, just so you understand what we're talking about. If you have an American Express card, they use massive expert systems to track fraud. So does Visa, so does MasterCard. How many of you have ever had a call to double check and make sure you had actually made the charge, right? Okay. So this is, I'm not, just for the purpose of people in Washington, I am not making this up. Do you agree? It is literally true. American Express pays 0.03 of 1% to crooks. New York State Medicaid, according to the New York Times, pays over 10%. That means, as a taxpayer, you're paying 330 times as much to crooks, 33,000% more than you would pay as an American Express cardholder. Now that's a level of government incompetence that's staggering. So the first place you save Medicare and Medicaid is you stop paying the crooks. It's between $70 and $120 billion a year. So you hear all about this super committee. Stop paying the crooks gets you between half and 2/3 of their goal without affecting anybody who's honest. But it requires thinking. It requires new approaches. I've talked to American Express, Visa, and MasterCard. All three are ready to go into the Congress and explain it. They'd all three go to Health and Human Services and explain it. The head of IBM did go to see the president and explained it. Didn't work. This is why Lincoln talked about new thinking, disenthralling yourself of the past. You have a paper-based bureaucracy trying to keep up with crooks who have iPads. It is impossible. Second, you give people a choice. We're now having people say we may have to means test Medicare. Why didn't you just pass Tom Price's law, Congressman Dr. Tom Price's law, that says if you're successful and you'd like to contract out, you're allowed to contract out. If you want to go and pay more to the doctor or hospital, you can go pay more to them. I mean, every liberal will tell you that that's impossible. So Medicare today is more restrictive than the British National Health Service. Why not allow people who are successful to have a choice? And you could institute next year Paul Ryan's model of support, for purchase support, but make it voluntary. And say to people, if you'd like to, and then you say to the insurance industry and others, you want to compete for the customers, fine. You don't have to, you can then say to everybody who wants to stay in the old order, fine, stay in the old system, but we're going to give you more and more opportunities to have better and better choices.